Um, I mean, as Monica said, I've been both working in academia and industry. I've been trained as a geneticist, a population geneticist, but moved into precision health and personalized medicine, or whatever you call it, uh, about 10 years ago when we started launching programs in Switzerland. I was part of the Swiss Personalized Health Network, and also director of the Health 2030 Genome Center, which was essentially the genomics arm of the Precision Health program in Switzerland. However, what we did in Switzerland was nowhere near what's happening in Qatar. And of course, I have heard many of these things before. I visited Qatar for the first time in 2014, but I've been very impressed by all the things that I've heard before I joined, and of course, I've been very impressed by what I've seen when I arrived. So what I'm going to try to do today is basically try to say a few things about what we're doing, the next phase of what we're trying to do now. Qatar has actually invested heavily, both in terms of infrastructure as well as in terms of overall education in the country, in promoting genomics, precision health, and generally science in many ways, in probably in a very surprising magnitude. And I think that this is something, when you see, for example, words like genetics, genomics, genome in regular, let's say, releases of the Ministry of Public Health. This is something that is not frequently happening in many countries, even nowadays, where genome is actually quite important. And I'm actually be very surprised how these words have become sort of the regular vocabulary of people in the government. And so it's a great position to be in, and I think that's one of the things that we are trying to capitalize. But of course, one of the fundamental things that we want to do is not only to be able to develop things internally, but also to create sort of international, global link with what we're doing, both for us to learn, but also to transmit some of the learnings. I'm a strong believer, and I've always been, that research and as well as innovation in healthcare is only going to come from global international efforts, and not from a very narrow national attempts that people do, not because also of the learnings, but also because of developments of technology and generally the ability to be able to solve problems together that cannot be solved individually. So I'm going to give you a bit of an overview of what we're doing, starting a bit from what has happened and moving into what we would like to be doing now. We're in the process of building our next 5-year plan, and so I'm going to give you, in the last few slides, a few glimpses of which direction we're going. So next slide, please. I like to start with this slide for one simple reason. It's actually a slide that I've been using for over 10 years now. And it occurred to me in one of my many flights. You all fly very much, I'm sure. So one of the things that was striking to me, and that slide actually came to me when there was this Boeing 737-8 MAX crisis. I don't know if you remember, when there were a number of planes that for over a few months have had problems. Some of them flipped, almost crashed. I think one of them crashed. And then within a few days, the whole international aviation blocked these planes from flying. So all airlines stopped. And I was wondering at that time, what would happen if a drug had a similar problem? And actually, it's nowhere near that. So even international aviation were able to respond within 3 days, given the fact that we have data that is shared across international borders, across countries and aviation authorities across the globe. If we started seeing, for example, side effects in a drug, this probably could take even a year or two before the system is alerted that there's something going on. And what that means is that we don't actually have the fundamentals in terms of actually understanding and building the knowledge that we need to build, and returning the learnings that we have, the experience that we have, into an international framework that will allow for some kind of surveillance. And I think that that's one part. The other part is we don't actually understand the human body as well as we understand an engine of an airplane. And that's a very simple reason for that. We actually engineer the airplane, the engine, so we know all the parts, and we know what every screw does, every part does, and we can probably move it around and try to achieve something. In the human body, we need to reverse engineer. And actually, that's one of the things that is quite important to be thinking about. As we're generating all this knowledge, how can we reverse engineer the human body so we know exactly what we're trying to do and why? Next slide, please. So again, some of the fundamentals that you all know, we all have a genome, and that genome defines initial steps of development, defines cellular interactions, define internal cellular effects, which then progress into, as we develop, into organs and whole organism phenotypes. And of course, over space and time, we have a development of cellular phenotypes that define the behavior of organs and so on. That's coming from the genome, but also it's coming from environmental exposures, some of which we are aware and we can control, and some of which we don't control. Sometimes you don't control the other, you're there, you breathe, and there's nothing you can do about it. Sometimes you can do something about it. You can change your diet, you can affect your exercise, but there are certain parameters you cannot. For example, infections. So all this complicated picture actually drives what the state of an individual is. And of course, sometimes we define a state of disease by setting up a threshold, but as we know, there's a continuum to phenotypes, cellular or otherwise, that essentially define the state of an organism. So trying to explore that space, one actually starts to think, what's the most important parameter that we need to measure? And the thing that has changed substantially over the last 10 or 15 years has been actually the availability of genome information. That has been actually the transforming factor that has moved into us thinking heavily about precision medicine or personalized medicine. All the phenotyping aspects, of course, we've had before. We can do a lot more now, but all these things have been relatively implemented. The fundamental thing that has changed the way we think about it is the genome. And of course, the genome carries quite a lot of information. I think we know by now that it defines approximately 50% of the variability that we have if you just average across all phenotypes across all populations. So next slide, please. So the Qatar Precision Health Institute is essentially the vehicle by which we're trying to bring both genomics as well as other types of clinical information as well as human phenotypes into the framework of Qatar primarily, but also globally, in order to be able to deliver the promise of precision health. Qatar started with two initial projects that you've all heard for many years. One was the Qatar Genome project, and the other one was the Qatar Biobank. Those two projects have been running for over a decade before the creation of the Qatar Precision Health Institute. They were actually running in synergy, but not necessarily in an integrated way. Particularly the Qatar Biobank has its own building and has been doing deep human phenotyping for a very long time. The genome arm was more of a sort of management of samples and analytical component. So essentially building the resource of genome through, of course, the combination of the Qatar Biobank. And those two things were synchronized because every individual that was being phenotyped at the biobank was also being genotyped. Now what we try to do is we integrated that. So last year in 2024, late April, there was an official launch of the Qatar Precision Health Institute. The two were operating under an umbrella of Qatar Precision Medicine Institute, which was not officially existing at the time. But since April 2024, it's now an official institute that integrates those two projects together with many other components that needed to be part of it. So the idea was to spearhead the national agenda of the implementation of precision health. Now, what is unique about the institute is that it's actually a vehicle that coordinates all precision health in the country. Even though we're under the Qatar Foundation, so not a government organization, but an organization linked with the government, we actually have the national mandate to be driving that strategy. We're not a big institute. We have about 100 people, but we actually try to leverage all the ecosystem around it. I'll go more into that in order to be able to deliver that mission. That happens on the one hand in terms of resource creation, as well as just coordination and implementation of certain processes, like, for example, clinical implementation. Next slide, please. Monica, I'm sorry, you have to switch the slides for me. So as I said before, the mission and the vision is actually quite ambitious. And one of the things that makes it unique is that there is an institute that does exactly that. In most countries, even the UK, where we have a very strong presence of genomics and precision health, there's no such institute that drives it individually. All this thing happens through collaboration of existing institutes. And one of the things that I've noticed looking at those kinds of programs frequently, people get distracted because they have to do their main job and to actually drive the national agenda for precision health. Here in the institute, our job is to drive the precision health agenda, period, which means that we don't actually get distracted by an academic appointment that we may have, writing a grant for a project, or, teaching in the university or directing an institute. That's our main job. Our main job is to drive that, and we do this in a very focused way, in a very determined way. And this vision and mission is actually something that is actually being supported centrally by many of the stakeholders, including the government, but also key authorities in the country. Next slide. Now, as I said before, the two projects have been around for over a decade. Actually, the biobank started in 2012 and the genome program in 2013. So they've been, incorporating participants. One of the things that is astonishing is that both programs have actually had major recruitment efforts that have been well received by the population. The Qatar Genome Project and Biobank are very well regarded within the country. People actually, line up to participate in these efforts. Initially in the biobank, and then of course in the genome. And the stakeholders have actually done a great job, and of course the institute itself and the key drivers to actually convince the public that this is something that is to their benefit. So it's one of the things that, and this has been achieved. Sometimes I say we, but I've actually had nothing to do with the recruitment strategy here. This is something that's been running over a decade, but this is actually approaching the culture and approaching the people and being aware of what actually needs to sensitize people and to make them feel included and to participate in these efforts. Now, one key thing to remember, particularly for what we do, is that all results that are of clinical significance are being returned to participants. And so participants not only feel that they can contribute to something big, which they do, building the resource and the knowledge, but they also get direct feedback, either on their phenotyping. For example, if they have too high cholesterol, or they get an MRI that seems abnormal, they always get referred back to the clinician, the relevant clinician, but also they get information about basic genetic information of clinical importance, like, for example, the ACMG actionable variables. So all these things actually has built trust with the population. By now, we have over 45,000 participants, and we have several releases. Currently, we're at the 25,000 genome release, and soon we will be on the 40,000 plus release. These are whole genome sequence. And of course, there's phenotypes associated with the biobank, as well as electronic health records. Next slide, please. This gives you a bit of an idea. I won't go into the detail of the deep phenotyping that we do. There's many aspects of phenotypes that are measured from measurements and blood tests, biomarkers, whole body MRI, as well as a lot of questionnaires that essentially give us a very comprehensive view of every participant that goes to the biobank. And of course, as I said before, this is connected with the electronic health records. Next slide, please. There's a number of as I said, the data is quite diverse, and we're starting now to integrate that in a system. We're actually trying to build the appropriate TRE so we can share with the investigators, initially within Qatar and progressively globally, in a way that also allows for a live update of the electronic health record. So not only are we getting the electronic health record at a particular time point when we pull it out of the system, but we could also be able to update the information in real time as these participants go into the clinic for another test or for an admission or something else. Next slide. Now, this is the Qatar genome timeline. As I said before, we've now reached over 40,000 genomes, the vast majority of which are genomes that come from the population cohort, essentially a random subset of the population. Those participants, what I did not say is that they're actually a mix primarily of people of Qatari nationality, with a fraction of them also being long-term residents. The idea being that we want to capture those people that actually have both the nationality and therefore the genetic identity of Qatar, as well as people that have been in the country for a long enough time to also be, let's say, impacted, quote unquote, impacted or influenced by the environment, be it, temperature, diet, air quality, and so on of Qatar, so we can measure something that is going to be directly relevant for the country. So we're actually scaling up the genome, and I'm going to go into the aspects of how we think about doing that. Next slide. Now, the new genomic, the current genomic release, actually, we call it new because it just happened to be the slide, is 25,000. So this is what people have access to. Very soon, there will be a 40,000 genome release. And this primarily is being used now by investigators that are based in Qatar, with international participants being able to have access to that through a collaboration with a local investigator. As you know, and I'm sure many of you have faced that issue, there's always that concern of how one shares data internationally. Of course, the UK BABA has been very generous and very open about that, but not all countries have either the legal framework to be doing that or the social understanding to feel free to do that. So we're actually navigating that to see how we can share the data as much as possible. We are actually building a proper TRE. We currently have an infrastructure, kind of a sandbox that we use for people to analyze the data. So data is not currently downloaded, but analyzed in our own premises. And we're exploring solutions for a sovereign cloud. And when I say sovereign cloud, I mean both located in Qatar, but also owned by a Qatari company. So we're able to put the data there, creating more flexibility for national and international participants to analyze the data without, of course, the risk of being of having the sort of data leak, but at the same time having the scalability of a cloud, because in-prem solutions are generally not as scalable if somebody wants to do some big analysis or start putting AI models and so on. Next slide, please. Now, the other thing that we would like to do, and I'll talk a bit more about it, is to move into the multi-omic space. So the way that the Qatar, the QPHI data, Qatar Biobank and Genome have been put together is with an emphasis on depth. So the idea would be to enrich as much as possible the information that we get for these participants. So in addition to the phenotypes and of course the clinical records, we are actually enhancing with additional multi-omics, which we believe is going to inform not only the health state of an individual, but also help in future studies. So currently we have essentially pilot studies of epigenomic, transcriptomics, metabolomic proteomics, and of course the genome, as well as immunoproteomics for, in some cases, over almost 3,000 participants. In proteomics, we actually have multiple technologies as well. And we're exploring additional technologies with the aim to scale this up to tens of thousands of people that we have this kind of data. This will be used not only for a better understanding of mechanisms so that we can dissect better the state of an individual, get better biomarkers, but moving to what I believe is an important component of precision medicine, which is actually drug discovery. I like the word precision as opposed to personalized medicine more, because I believe that this includes what I call precision drug discovery, which is more the idea of using very deep mechanistic understanding in order to be able to get to the right target and to get to what's the specific population that will benefit for a drug that will hit a particular target in particular conditions. I'm saying that all from my experience, also from the pharma perspective, because there I saw that we still actually could improve quite a bit our mechanistic understanding through these resources in order to increase the probability of success, which currently for any target in the pipeline is below 0.5%, which is rather sad, thinking that a business could actually maintain itself with such a low probability of success rate. So we need to do our best in terms of generating the appropriate data to improve that. Next slide. Now, The ecosystem of QPHI, as I said, is not just 100 people that work. We're actually bringing a lot of different components from the ecosystem in Qatar, but also globally in some cases. As you see, we have a number of international organizations, and of course, ICPerMed is going to be one of them, hopefully very soon. Uh, so we actually engage, of course, the healthcare providers, hospitals, private, and of course, and primary healthcare, the community. We had very good relationship with all the patient organizations and generally the community. As I said, reputation of QPHI is very high within the community of people in general. Research organizations, either in university or otherwise, academia, lots of universities, and as you probably know, Qatar has a number of American universities and other ones that are actually residing and have their own departments within Qatar, with Cornell being one of them, where we have very strong partnership, and of course Carnegie Mellon and Texas A&M that are more on, sort of, let's say, the engineering side. Industry is something that we're starting to explore, and I'll talk to that very soon. This is always a challenge in terms of engaging with industry and what the goals are. And of course, education, from primary education all the way to university education, funding agencies, primarily local funding agencies that drive the strategy of funding internally to support what we're doing, and of course the government. The link with, for example, the Ministry of Public Health, and of course the National Cybersecurity Agency and many others is very, very strong. And for example, just to give you an idea how engaged the system is, I have frequent, probably weekly exchanges, either as a call or as a text with the Minister of Public Health. That the link and the engagement is so strong that this actually becomes an important component of the development and the improvement of the health system in Qatar. Next slide. Now, of course, research is an important component. Now, as QPHI, we don't have a strong research arm. Of course, we do research. And Hamdi, who's I think he's attending, he's essentially the driver, the leader of the Institute on the research side. But what we try to do is we try to stimulate research coming from both our resources, things that we generate, facilitation with respect to agreements, for example, this disease genome database that helps people identify cohorts that we sequence, as well as specific grants that we co-fund with QRDI, the Qatar Research and Research Development Innovation Council, so that we enhance the precision medicine research in the country. And of course, we participate in international consortia, contributing the perspective of our data in terms of associations and otherwise, so that we actually represent the Arab population and supplementing the global results in a particular area. And you see some of these examples here. So we are contributing to research, but we don't have yet a strong research arm. We don't, for example, individual group leaders and faculty model. And it's probably not our priority, because we're trying to facilitate research rather than ourselves lead the research. Although I'll come to that in a very important component a bit in a few slides. Next slide, please. We had multiple rounds of what we call research consortia that we trigger internally, thematic ones, so that we bring all the investigators together from different areas to work together around the data. And of course, we help them both in terms of infrastructure as well as in terms of guidance in delivering that promise. This is also essentially upskilling the local ecosystem so that they get more familiar, and of course, then linking them to international partners so that they can actually participate in some of these international studies. Next slide, please. This was done with the initial rounds of the genome. Now, of course, we're launching a new round of thematic areas, and Hamdi is leading those. Is leading the creation of this consortia. As you see, there's cancer genomics, cardiovascular disease, and so on. Nothing surprising. Of course, we're looking at AI as a very important component of what we do, and I'll come back to that in a few slides. So there are many of these efforts that we're doing, and of course, some of them we're leading because they have a particularly strong translational component. that we are also want to bring closer to the clinic as soon as possible, like, for example, pharmacogenomics or HLA. Next slide, please. Now, one of the key missions that we have is to do clinical implementation. Now, of course, we are not a clinic, we're not a hospital, but what we need to do is we need to bring these discoveries as close as possible to be ready to be implemented in the clinic. And there's quite a lot of effort there. That's something that Dr. Warha is leading, who is our Chief Medical Officer, in terms of shaping the space of clinical implementation, to building those partnerships with hospitals, and then progressively moving forward to be able to excuse me for that, but I just want to shut my dog, so that we can get to, excuse me for a minute. So that we can shape essentially the way that we do clinical implementation, and familiarize the doctors and many of the clinicians with the types of data that we bring. As you know, many of these people have been trained without genomic knowledge, without sort of the depth of phenotyping that we do today. And so it is important that we don't only bring the discoveries forward, but we also bring the technologies, the methodologies, so that people are able to properly interpret and, of course, bring it to the clinical setting. I'm sure many of you have faced these challenges, so this is one of actually the most difficult things that we have to do. How do we bridge that? Essentially, there's what we call a death valley, equivalent to the startup death valley. There's a death valley in terms of bringing discoveries into the clinic. And that's something we're trying to work very hard. For example, one of the key issues that we have is, how does one create the funding framework for new discoveries to be implemented by the health system? And there's a number of different ideas that we're exploring in collaboration with the Ministry of Public Health, in order to be able to bring all this together, so that we can essentially fill up the death valleys and accelerate this implementation for, of course, the benefit of patients. Next slide, please. Now, as I said, there's a number of different components to that, and I'm not going to sort of go into all these things. But of course, what we do is we set up, of course, there's a discovery component. The discoveries can come from anywhere, including international discovery. So whatever we think is important, we then devise pilot and clinical trials with the clinicians, specific departments within the hospitals. We bring all the necessary infrastructure and analytical power close to them. And then once we feel comfortable this is ready to go, we start, of course, the negotiation with the chief financial officer of the hospital, and of course the Ministry of Public Health in terms of approvals, in order to be able to implement this at scale. There's a number of different projects that we have right now coming in that direction, but we're trying to actually build a systematic framework so that we can do it efficiently, and we do this in a rapid way, so that these discoveries reach the patients as soon as possible. Next slide. There's a number of different applications we have. We have essentially, for example, wellness and genomic reporting. This is something that comes from the genome information that also goes into the space of risk assessment and so on. There's carrier screening, particularly for breast cancer. There's a clinical genetic acid testing, which is something that we do in particularly with an array that is designed specifically for the Qatari population. There's pharmacogenomic projects that are, of course, very important. Next slide. We have also proactive programs of looking at, as I said, polygenic risk scores. There's a number of newborn screening projects that we're launching, and we're trying to augment them now. And of course, a number of things that have to do with reporting actionable mutations from ACMG, as well as other types of more, let's say, interventional studies that we can link some genomic information in order to be able to facilitate, especially when we, for example, bring this companion diagnostics and so on. So we have a number of these programs, but of course, in my opinion, this is just the tip of the iceberg and just the beginning. There's a huge potential here, and what is unique is that, as I said before, we have the health system very close to us. So sky's the limit in terms of what can be implemented as long as we have these discoveries in place. And so all we need is just putting the processes in place. The desire is there, the willingness is there, and I think also the funding is there, especially as we're starting to go into more health economic approaches, so that we're actually planning over 5 and 10 years, so that we don't see that from us in terms of how much money do I have to spend to do this, but rather how much money do I save overall if I were to spend 10 million today over, from, for example, breast cancer screening. And so we're actually trying to avoid this sort of natural thing that we're looking at budgets on an annual basis. And of course, every new thing that we do appears as a burden, as opposed to what is a long term saving, both in terms of the financial component of the health system, as well as, of course, the productive aspect of the productivity from the population perspective, because people don't spend as much time in the hospital, they don't spend as much time in a stress situation trying to treat themselves or to be in uncertainty. So there's many aspects of economic impact, economic growth that actually have not been as highlighted, I think, in some of the programs that I've seen. Certainly they have in Switzerland when I was working on that here. And this is something that could be a unique opportunity in terms of economic growth. That's coming from the savings, but also economic growth from the overall industry of working around these kinds of prognostic, diagnostic, and drug discovery products. So to me, precision health is a unique economic growth opportunity for every country, as long as it's integrated not only in the health, in the Ministry of Health, but it's integrated in the Ministry of Development, in the Ministry of Finances, in the Ministry of Innovation, or whatever different ministries countries have. And that's something that's an approach that we're actually taking here, in order to be able not only to trigger that engagement, but also find the funding to support these expensive efforts that we're trying to support here. Next slide, please. Now, of course, what we have, in addition to treating patients, we're training young people. And when I say young people, I mean very young people, starting from kindergarten all the way to high school and even into university. We have programs, there's apps, there's different cartoon books that actually describe certain properties of the genome. There's the Genome Heroes that actually is something that's developed in our teams at QPHI. And this is something that has had a huge impact, not only nationally, but also internationally. The app is being used by many, many people, and kids are having fun with that. And this is actually quite unique because, children are now understanding in a pretty, broad way, not in specific schools, but pretty much anywhere, properties of genome. That's why I said before that the words genome, genetics, they're not foreign to people. They're actually part of the daily life. They know the biobank, they know the genome project. They've also had their kids tell them about that when they go to school, or they participate in activities in shopping malls where we organize. So this is now becoming actually integrated part of the society, which is of course quite important if we want to launch these sophisticated frameworks in the future, where people need to have an understanding and to feel comfortable to be participating. Next slide, please. Now, where we go from here. So, as I alluded in several ways, I think the Qatar and Precision Health in Qatar has a unique positioning. We have an institute that champions and leads precision health in the country. We have a buy-in by the ecosystem, universities, research, and hospitals. We have a buy-in by the population, strong support by the government. There's an entrepreneurial mentality in the country. And that's something that, of course, goes back to the point about economic growth. So if we actually present also economic growth opportunity on top of the opportunity of health improvement, that could attract a lot of attention by authorities like the Qatar Investment Authority and other authorities that actually have a financial focus. And we can actually build a model in a small country like this of 3 million people that could become a model for precision health globally. Now, understand that this is very ambitious, and we don't want to sound pretentious, given that we have relatively small number of people and we have relatively small number of genomes relative to what other countries have. But I think actually, for myself thinking, as an external, still having been only for 6 or 7 months, the opportunity is there, and that's one of the things that we want to link with the international community to exchange those learnings as we develop this, but also to be able to incorporate some of the experiences and things that haven't worked. I always use the example sometimes of the Athens Metro and the Olympics. The Athens Metro and the Olympics was, at the time when the Olympics happened in Greece 2004, was the best metro in the world. Why? Because we built it last, the last country in the world that had a metro. Of course, by now it's not as good as it used to be. So by being in that situation where we are, we can incorporate learnings and bring them to the best possible way in the context of all the infrastructure and investment that we've had. And so we can build that model that then can be tested in many different ways and can provide learnings globally after being implemented in this small country. Next slide, please. So the way we're thinking about it is to go wider and deeper, to build population-based prevention programs, systematic implementation involving the private sector, promoting industry ecosystem, lead the development of data models. Of course, AI could be an important component, and of course, providing a model for precision health globally based on this small country. And I'm going to elaborate on this in the next couple of slides. Next slide, please. So what we're thinking is we want to go both wide and deep. On the one hand, we want to, instead of just going to the few number of people that we do now, about 40,000+, we want to go to a population wide. So essentially, the framework of return results that we have could start becoming the clinical implementation itself. So the idea would be to go as deep as possible, hundreds of thousands of people with initially low pass sequencing. That's something that at least will give us a good strength of genotyping. And of course, as we go to lower prices, we can go into more high coverage sequencing. Now, one thing you need to sort of understand here that probably is not immediately visible is that because Middle East doesn't have as many of these companies like Illumina or other companies having a subsidiary here, which means that we always have much higher prices than people have in Europe or in the US in terms of sequencing. And that's always something that we were trying to deal with. So one of the solutions is to actually scale up in a large enough way that companies would actually have an interest in establishing business here in Qatar. So that's one of the things that is going to be a multiplier in many of the things that we do. Of course, we're linking to clinical information, electronic health records, and of course, polygenic risk scores and other risk scores that we can get. Now, Qatar has had electronic health records for more than a decade, and actually it's very, very deep information. So it is actually one of the best countries in terms of being able to implement that. And now we have a Ministry of Public Health linking between the public and the private sector, the electronic health records, what we call an e-hub. So we actually have one of the most integrative electronic health record systems one can find in the world. So building that so we can have early detection and prevention programs that will benefit the population. This actually fits very well with the Qatar goal of increasing the health span and reducing premature mortality by a certain factor. And of course, that means that this can be supported by, that's primarily for productivity aspects. That can be supported, again, as I was saying before, not just by the health ministry, but also by ministries that have to do with development and overall productivity of the country. At the same time, we want to go deep. We want to understand the mechanistic biology. So we're going to be continuing to some degree the high-depth genomes, but integrating tens of thousands of samples, multi-omics, as many technologies as we can, getting into more mechanistic understanding, which will allow us to engage into drug discovery partnerships with pharma and biotech. Next slide, please. At the same time, we're putting together we're trying to innovate on the clinical implementation. Here's 6 pillars that we're building. Open collaboration. We need to have actually a very transparent and open environment to be able to share knowledge, shared infrastructure with hospitals so that we can develop this, to have a clear IP framework that will allow us that will not block sharing of information and knowledge, so that everybody gets the appropriate credit and, of course, the return. Strong human capital training, but as well as bringing people here with unique talent, to have a strong ecosystem that also is supported by regulatory authorities and regulatory frameworks that allow us to accelerate what we do. And of course, to be very focused on the mission so that we can get these things done. And ICPHI can actually be the driver in that, because there is an institute that can drive this strategy. It's not just a collection of multiple different people from different institutes that will do that. Of course, we work in partnership with many of these stakeholders here. Next slide. And a very important thing, we want to bring the industry into this, and we want to do this in two ways. One is essentially to work with the data and partner with the data in sort of two levels. One is kind of a FinGen model, where we're going to have partnership and augmentation of data with pharma companies. We'll be launching that framework in the next few months. And of course, specific strategic partnerships where we have a specific interest, where we will be participating as well and sharing the IP and sharing the value. For example, similar to collaboration that have been done between companies when I was in GSK, between, for example, 23andMe and GSK, where we can actually generate value, economic value for the country, but also specific returns in terms of diseases that have a high prevalence in the country. And we actually are building a governance framework for that in terms of sharing data, as well as what the agreements look like. Next slide, please. At the same time, we want to actually engage the industry to come in, even if we're not partnering directly with them. So the idea would be to leverage on the data, but not only on the data, but other types of infrastructure that we have, in order to create what we call a one-stop shop entity, so that industry, companies, small companies, startups, or big biotech can plug into this one-stop shop and engage in activities here in Qatar. And the idea would be that we're actually trying to solve the problem of being able for one company to come in and deal with administrative, infrastructural issues, finding talent, finding facilities that they can do some of these, and of course funding, because we have authorities that can provide substantial funding, not dilutive or non-dilutive, in order to be able to support the business here. And as I said, this is essentially the combination of triggering a lot of activity so that it can return back to the patients, of course in Qatar, but globally as well. That could be a global impact effect. And at the same time, creating an economic growth opportunity for the country if we create a vibrant ecosystem for biotech and pharma to be located in Doha, given the infrastructure that we have, research parks, and so on. So this is essentially leveraging on this to create a much bigger ecosystem beyond what we are necessarily directly interacting with. And hopefully some of these companies will see the opportunity, both from the business plan perspective as well as the economic perspective, to be able to be located in Qatar. Next slide. So our future strategic pillars and the way we're developing our program is on aspects of new data generation, which I talked about, discovery at scale, and this is something we want to do with international partnership by bringing together strong analytical and also data infrastructure to get in the context of global discoveries that are being made, innovation and clinical implementation, as well as industry engagement. And we think that these 4 pillars over the next 5 years will take us to a next phase that will allow us to not only participate in a strong way in the community of precision health and beyond, but also to be able to lead some of these efforts together with other partners in order to be able to drive globally precision health to actually realize its potential. Because I think that we've talked about it for a long time. A lot of people have been interested. We have a lot of consortia, this being one of them, where people have come with a strong conviction and a strong desire to have an impact, but we still haven't seen yet that transformational impact that we all expected. And I think there's some catalysts that we need to bring together to actually be able to achieve that. I think the community is ready, and of course, we are QPHI. We're ready to be part of it, this global effort. So next slide. We have a lot of partners. I'm primarily going to talk about the local partners, the Qatar Science Park and Technology Park, Ministry of Public Health, Hamad Medical Corporation, Sidra Medicine, Qatar University, Weill Cornell, Hamad bin Khalifa University, and the Qatar Computing Research Institute. And the next slide has a few more partners. As I said, the ecosystem is very vibrant here and very supportive. And of course, we've benefited from a lot of international partnerships. And of course, we're looking forward to be a strong participant in ICPerMed. And with that, thank you very much.